Well, if you've got a persistent pain in your ankle or something just doesn't feel right, it could be the sign of a bigger problem. Joining us this morning is Dr. Randall Marx. He's an orthopedic foot and ankle surgeon with the San Antonio Orthopedic Group, and it is a delight to have you this morning.
Good morning,
Dr.
Bridget.
Marx.
Good to see you.
Thank you for being here.
Thanks for having me here.
So I've got to admit, I'm one of these people who, if I have a pain, I usually let it go and think it's going to kind of play itself out. What kinds of people are you seeing, first of all, with ankle pain, and where do you go from there?
Well, I'm an orthopedic surgeon first and foremost, so we treat pretty much everything in the body that's musculoskeletal, but my subspecialty is that of the foot and ankle. So we see everything from minor sprains and strains to broken bones to ankle arthritis. So we see a little bit of everything, but for the most part, minor injuries are what we see.
I've got to be honest, I didn't know there was a thing called ankle arthritis. What is it exactly?
Well, ankle arthritis is essentially when you develop degenerative changes to your ankle joint. It is when the cartilage surface that lines your joint begins to wear down, kind of like the tires on a car, where the tread begins to wear down and it becomes bald over time. It essentially is characterized by swelling, pain, stiffness. At times it can progress even to deformity. And it's characterized also by a negative impact in your overall quality of life. It's been correlated almost to the same extent as severe heart disease and kidney ailments.
So just over time?
Yes, just over time it can cause progressive pain and dysfunction.
Yeah, now what are some of the common methods you use to treat it?
Correct. Well, arthritis is something that is progressive, and there is no solution or cure for it. So it's important to know that first off. As a surgeon, we are uniquely qualified to offer surgery, although we want you to reach that point over time and when you're ready for it. So we like to make sure that we offer you lots of non-surgical options such as anti-inflammatories, physical therapy, bracing, injections. There's multiple creams and medications you can apply topically, but ultimately if you don't get relief, surgery is an option.
Now, I know that there are options like ankle fusion and replacement. What are the differences, and which do you prefer?
Well, once you've kind of maximized the conservative management, surgery becomes an option. And when it comes to surgery, there's two main viable options. One of them is a fusion, which is when you weld the ankle joint together, which completely eliminates motion throughout that joint. As you can imagine, that is not a natural state.
Sure.
It gives you a stiff gait, and it makes the joints around it become progressive in terms of its arthritis over time. So ankle replacements are a little bit better of an option. It allows complete restoration of function and motion. This is essentially what an ankle replacement looks like. Here's a video showing that there's motion going up and down, and the ankle replacement that I prefer here is called the STAR ankle replacement. Here's a model of what it would look like. Essentially, it is a metal piece that replaces the end of the shin bone. There's a metal piece that caps the ankle, and then this little plastic piece, which is the weight-bearing surface. This is a polyethylene.
Okay.
And a STAR ankle replacement is very unique in that it has three components. It is the only one of its kind that's approved for its use in the United States.
Wonderful. A lot of good information there.
Yes.
Dr. Marx, thank you so much. If you're interested in learning more, the San Antonio Orthopedic Group has 7 convenient locations around town. There's a phone number on your screen to schedule an appointment if you'd like. 210-804-5400. We thank you so much
for
being here.
Thanks, Bridget.